Today we're going to talk about common diagnoses in the young overhead athlete. We do see traumatic injuries in this particular population, but for the most part, they're usually a result of overuse. Things such as playing tennis and throwing a baseball result in the repetitive overloading of the shoulder and the elbow. And oftentimes it's related to fatigue, too much practice, not enough rest, or poor recovery, which will lead to more injuries in the young overhead athlete. Kids, for example, just do not warm up. It's tough to get them to warm up. I like to teach my throwers and tennis players that they need to be sweating before they start to throw or hit a tennis ball. And kids often just play. They've had inadequate strength and conditioning. It's never too young to start a kid on a strength and conditioning program. And sometimes it's just related to poor mechanics. And this can predispose, but that's not always, can predispose one to injuries, especially in throwing. And really the wild card in this population is the open physes or growth plates. Throwing velocity can be a factor in overuse injuries. It's been demonstrated that the harder throwers, the bigger and stronger, taller and heavier players actually have the most injuries and the most surgery. And they're often more highly recruited and overused. So we often have to pay close attention to the harder throwers.